Okay, so video number 9 here. Today is March 24th, it's Sunday. As of this coming Tuesday, it'll be exactly 30 days since I had the surgery. Right out of the gate, I'll go ahead and see if you guys are getting a decent look at the scar. It's healing up really, really good. It's still really puffy right here. And I'm still swollen a little bit here, not horrible. Recently, in the last, I'd say, 4 or 5 days, I've been able to feel this part of my mouth again. It's getting a little more condensed as to what is exactly numb. Like this feels totally numb right here, but from here on up, I can feel everything. And right about where the scar is, I can feel on down and up to the scar, which I couldn't before. So it's healing good, and all throughout, especially last week, I'm getting these tingling feelings, and I don't know if that's that nerve doing its thing, if it's just, all this numbness wearing off. I don't know what it is, but I can feel things happening there. So that's been going on. So last week, I believe Wednesday, I went to see my facial nerve doctor. And what she's going to do is she's going to put a weight in this eyelid. You can see how, when I'm shutting my eyes, they're not going at the same time. They're like, this one's not quite hitting down all the way, and it's making that eye irritate and water. I can close it at night. I'm not having issues with it at nighttime. It's mainly during the day where I'm not blinking it, or when I'm blinking, it's not shutting all the way. So that eyelid weight that they're going to put in there, it's like a real quick surgery. I think I'm in and out of there in like an hour. They just put this little eyelid weight in there, and when I went there, she actually stuck it to my eyelid with like a little piece of sticky tape, and I could feel it. I mean, it was amazing how well it worked. So I got that coming up next Friday. That is on the 29th. And then I also met with my oncologist this week about the radiation. And we did what's called a CT simulation. It's where you go into they sit you on a table. You go into a CT scanner, which looks like a great big donut. They stick you in there, and that goes around and kind of programs out exactly where this radiation is going to go, where it needs to go, what they need to do, etc. What's involved with that is they give you a mouthpiece to move your tongue over to one side so you don't pry your tongue off with the radiation. And I'll suggest when you do that, if you're going through the same thing, make sure the thing is all the way together before you put it in your mouth, because mine, they had me just do the mouthpiece and then they clicked the guard over and then stuck it in, and then it was kind of like digging into the roof of my mouth, where it was like I was set up for that not to be in there, and once it got in there, it was kind of painful. So if you ever go through that, make sure you do the whole mouthpiece in one shot, because then you'll get it right the first time. Then after that, what they do is they make a mask of you. It's you exactly. So you lay down on the table. They take it feels like a warm washcloth. They lay it over your face and mold it right to your nose, your mouth, so your head stays perfectly in the same spot, and they can put the radiation in, or shoot the radiation in, or however they go about doing that. So anyway, so I met with my oncologist. We got all that done. We got the CT simulation done, and we're looking at 6 weeks of radiation, which is 30 rounds. From what I understand, it takes about 10 minutes a day, you use that mask and the mouthpiece, and they said it's real similar to the CT simulation. It's about the same thing. And my appointments are early in the morning, so I'm going to be done and over with and back home by probably 8:30 every morning, which is kind of nice to get it all just done and over with. But that's going to start on April 3rd, and that's going to go all the way to May 15th, and May 15th I'll be done. And then after that, it's check up and see. I think for most people, after they've had their surgery and their radiation and everything, they're doing checkups every 30 days, or 3 times a year, something like that. I don't know what I'll wind up doing. I'm just going to get that far first. So, like I said, I've been kind of one stepping it all the way through here. I'm looking forward to getting the eye weight, just so I can get a little bit of irritation left, or not have this eye be as irritated. And then also just to get the radiation done and over with is all I'm looking to do. So I'm just gonna grin and bear it for the next 6-7 weeks and take her from there. But that's where I'm at. And like I said, for 30 days in, I'm starting to feel a lot more. The swelling's starting to go down quite a bit. I mean, from where it was, it's gone a long way. So yeah, so I'm doing good, and looking forward to just get everything done and over with. So my next video I'll do right after that first radiation treatment, just to let you guys know how it's going, and then I'll kind of do them maybe weekly or bi-weekly to see what you have as far as redness and pain and whatnot. I'll kind of talk about that. Well, as far as my actual pain meds from the surgery, I've been completely off of them for 2 weeks. I haven't taken anything but a few Tylenol or Advil or things like that. So the pain hasn't really been too bad in the last couple weeks. This first 2 weeks from home from surgery, it was there. But last couple of weeks, it really hasn't been that bad. I mean, it's there, but it's not horrible. Just to let everybody know. So, but look for my next video. I'll be doing that, like I said, right after that first radiation treatment, and I'll show you the eye weight, see how it's working, and we'll go from there. So, see you later.